most emergency thing which you'll encounter in a daily life. So you should be very well versed with this disorder, right? So you can say it's a pediatric emergency. So in this lecture, at the end of this module, what you learn, classify and diagnose the pediatric epileptic syndrome, okay, according to clinical classification. Second, you will try to manage and treat pharmacological treatment, okay. That means you are learning the medication which is used in anti-epileptic in terms of pharmacokinetic and pharmacodynamics and their uses in a proper way. Yeah? Then third, you will learn what in second advanced intervention, right? Like surgery and vagus nerve stimulation. These are the advanced in epilepsy. So before going to this lecture, start the lecture. So I will try to revise you basic EEG concept of EEG. You might know syndrome divided into two categories: good outcome syndrome and unfavorable outcome syndrome. This severe condition which is not so first of all, good outcome will take as per age group, again further classified into age group: neonatal, childhood, adolescent. Okay, in this good outcome syndrome. So basically neonates, you have to, if you know this classification, you'll be able to rule out based on the age group only. If you know the two seizure, we come under the neonatal with good outcome syndrome. So benign familial neonatal convulsion and benign idiopathic neonatal seizure. Okay. If you know childhood, Rolandic epilepsy, childhood absence epilepsy, and adolescent, juvenile myoclonic epilepsy, juvenile absence epilepsy, the lot. These whatever I included in this have a good outcome in this good outcome syndromes, right? It's the most
Not
emergent.
all childhood epilepsy is the same. Correct classification leads to the right treatment. Classify epilepsy by age of onset. Infantile syndromes include West syndrome and Odahara syndrome. Infantile spasms are a red flag for developmental delay. Childhood syndromes include absence epilepsy and Lennox-Gastaut syndrome. Absence seizures present as brief staring episodes. Adolescent onset includes juvenile myoclonic epilepsy. Early morning jerks are typical of JME. Age plus seizure type helps you reach the diagnosis. Save this for quick revision.
West syndrome, and it's a very poor prognosis. Now, these West syndrome, what is West syndrome? It's a very particular thing, like isko slam. It's you can see in this slam spell, like flexing the neck in intervals. So, what is the classical triad of this? Infantile spasm is cluster of flexor and extensor movement, and it will see. So, single episode abnormal neuronal activity is seizure. When it persists for longer duration, it's called epilepsy, right? In a simple term. Getting? So why this epilepsy happened? Why seizure happened? Due to massive failure of brain normal inhibitory mechanism. So brain has their own inhibitory mechanism, like GABA aminobutyric acid. It's an inhibitory neurotransmitter. If there is a decrease in quantity of GABA inhibition, or if due to any reason GABA is not working or not released, so normal inhibitory activity of brain is lost. One this, and second is a overwhelming of excitatory drive like glutamate, NMDA receptor. Okay, these are reason behind this seizure or epilepsy continuous. Now scenario change. Earlier, what his definition was like 30. Earlier time duration less than 30 minutes seizure is known as a seizure, and more than 30 epilepsy. This was a old terminology, old definition. These are uh, not valid now. Instead of what we are using, two critical time period we are using for defining any type of seizure, right? So getting here, why I had made you understand what
Seizure lasting more than 5 minutes? This is not normal. This is status epilepticus, a medical emergency. The brain keeps firing continuously. Damage can begin. Signs: continuous jerking, no recovery between seizures. The biggest mistake? Waiting. First-line treatment: benzodiazepines. Act fast. If uncontrolled, move to second-line anti-epileptics. Always secure airway, breathing, and circulation. Early treatment prevents brain damage. Don't wait 5 minutes, act fast, save the brain.